Is it Simmonds, Thompson positive or negative? Hello and welcome to this week's Urgent Bite, brought to you by the Royal New Zealand College of Urgent Care. My name is Guy Melrose and today we're having a look at the Simmonds-Thompson test. Most of you will be familiar with this eponymous test, used to determine an Achilles rupture. With the patient kneeling their affected leg on a chair, you squeeze the calf and look for a plantar flexion response of the foot. The movement of the foot would indicate the Achilles tendon is at least partially intact. No movement would mean that the puppet has had their strings cut. But how do you then document this in your clinical notes? I don't know about you, but I find this confusing. As with any documentation, it is imperative that we accurately record our findings, so confusion is never a good starting point. Have a read of the Life in the Fast Lane article linked in the show notes, which clearly describes the test and the findings. So the test is positive when the foot does not move. I think my brain gets confused because it is a positive sign when there is an absence of something. Most other signs seem to be positive in the presence of something. Rovsing's, Finkelstein's, Mulder's sign, and so on. So I like how the Life in the Fast Lane article finishes. It says to avoid confusion you can write, there is presence of plantar flexion with the Simmonds-Thompson test, or vice versa. I personally find that by taking this approach, I avoid the risk of incorrectly recording my findings. So I'd be interested in other signs that are considered positive in the absence of a finding. Email podcast@rnzcuc.org.nz if you have any. Now we'll be back again next week with another Urgent Bite. I look forward to seeing you then, but for now, thanks for listening.